Complications due to dry cough. The complications may vary from person to person, due to difference in anatomy, and also depends on the severity of the cough. If a person is suffering from a co-infection or disease, the complications can be interlinked or the coughing can be due to already existing disease. This may include the following. Fever. During any infection, it's the body's normal mechanism to activate an immune response, and fever is the usual during this reaction. If a person's body temperature rises above 37 to 38 degrees Celsius, then the person is said to have fever. Runny nose. It is caused when there is inflammation in the nasal area or the tissues. To stop this, a person has to take medicines to reduce the inflammation. Sore throat. A person with sore throat may feel itching or irritation in the throat. There may be even pain that can get worse during eating or swallowing something. Body ache. When the body encounter the pathogens, it sends white blood cells to fight that infection. Due to this, there is swelling and tiredness in the cells and tissues, therefore make the person feel aches in common body areas such as brain, back, legs, etc. Upper and lower respiratory tract infections. This is most common effect during cough, as coughing causes the air to exert a greater pressure on the walls of lung cells and tissues, causing them to rupture. This opened the passage for pathogens such as bacteria and viruses to penetrate deep into the upper and lower respiratory tract and cause several secondary infections. Collapsed lungs. Due to the vigorous and forceful coughing, the tissues and cells of the lungs experience a great pressure that leads to collapsed lungs during chronic coughing. Red eyes. Vigorous coughing also causes subconjunctival bleeding, causing redness in eyes. Cough urination. Due to the pressure exertion on the body during coughing, that the person urinates. During this, the person is not able to control the urination due to the experienced pressure. Cough defecation. It's the same phenomena as that of cough urination. The exerted pressure is with such as force that the person defecate unwillingly irrespective of the location he/she is in. The cough urination and defecation cannot be controlled by the person willingly, as this happens with uncertainty along with coughing. Pelvic hernias. It's the bulb-like appearance on the either side of the pelvic bone. This is caused due to forceful coughing. In this, there is a burning sensation and pain in the pelvic region while coughing, sneezing, bending. Costochondritis. It is the pain and swelling in the joints between rib to cartilage, costochondral, and cartilage to sternum, sternocostal. It either affects the one side of the ribs or can affect both sides, and characterized by the persistent pain in the ribs and chest muscles. Fatigue fractures. In some severe cases, the ribs became tired due to consistent pressure and swelling that leads to the fracture in the ribs. Cystocele. Due to chronic cough, the urinary bladder of the woman bulges out of vagina, also known prolapsed bladder. In this, the suffering woman will feel something is falling out of vagina, heaviness around vaginal area, and difficulty on urination. Treatment of dry cough. In mild cases, it can easily be treated with some medicines and home remedies. However, if it is associated with some other serious medical infestation or causing some serious medical condition, its treatment will be done according to the identified condition. In most of the severe cases, dry cough happens due to other secondary medical condition and can only be managed, not cured. Its treatment may include taking some medicines such as dextromethorphan, which may help with cough refluxes. Other medicines include nasal sprays, decongestants, paracetamol to relieve fever, painkillers to relieve pain. In case of lung cancer, chemotherapy, radiotherapy, radiofrequency ablation, and immunotherapy can be used under the supervision of oncologist. In case of collapsed lungs or idiopathic pulmonary fibrosis, lung transplant, oxygen therapy, pulmonary rehabilitation, and medication can be helpful. Doctors advise to take honey as it can better cure dry cough than any medicines. It soothes the throat and suppresses the coughing. Although it is not advisable to give honey to baby under 1 year of age, as it can cause botulism. Hard cough drops and candies can also be taken, as it increases the saliva production and therefore soothes the throat and moisturizes the air passage, so that air can pass easily without any irritation. Drinking plenty of water helps to stay hydrated and relaxes the throat muscles. The water should generally be lukewarm, not too cold and not too hot. If one finds it difficult or tasteless to drink pale water, then it can also be infused with honey or some other liquid smoothers for the same. One can also refer respiratory therapist for ACTs, i.e., airways clearing therapies. They are employed to clear the airway tracts and get relieved of the coughing and itchiness in the throat. In some other serious conditions, one is advised to refer doctor immediately for the diagnosis. Prevention of dry cough. In order to prevent the dryness, humidifiers can be installed at home. Air purifiers can be used to get rid of environmental irritants and pathogens present in the environment. Avoid acidic food in order to avoid GRED. If you have some sort of allergies from molds, pollens or fragrances, then always cover your face with a face mask and avoid using perfumes. Maintain good hygiene around you. Quit smoking, especially secondhand smoking. Consuming a balanced diet, rich in high fibers, protein, low trans fat. And manage a healthy weight. Watch your blood pressure and cholesterol. In this way, you can avoid dry cough due to consuming ACE inhibitors. Go for a regular body checkup to prevent the occurrence of any other medical conditions. How do I know if I have dry cough? The cough which does not produce any kind of mucus or sputum is considered as dry cough. You will feel ticklish and itching in your throat area as primary mild symptoms. If cough persists for more than 3 days, it can cause pain and swelling in the tissues of air tract. When to consult a doctor? Generally, a normal dry cough lasts for 3 to 5 days with mild symptoms such as itching in throat, mild pain and coughing that is worse during night. But if the coughing lasts for more than 5 days or you find difficulty in breathing, chest pain, shortness in breath, then immediately refer a doctor to avoid any serious damage. What can do's and don'ts during a dry cough? During a dry cough, avoid smoking, even till you feel better, drinking any acidic food, cover your face with mask, drink lots of water, avoid cough syrups that are used for coughing with mucus, eat non-oily food with minimum spices and avoid running or other exercises that can cause dehydration or dryness in throat region. Is dry cough a sign of COVID-19 infection? COVID-19 infection may start with dry or cough with mucus. And it characterized by other symptoms as well such as chillness, recurrent fever, body pain, difficulty in breathing, and congestion in chest.